音がしないけどいいの
Now we start the Distal Bypass Olympics Games 2021. So, but today's moderator is Dr. Ohki and Dr. Khan. So please start.
Good morning. The first Distal Bypass Olympic senior session will be held this morning. My name is Dr. Ohki from GK University in Tokyo. And my co-chairman is Dr. Khan, and he's with us today. First of all, I'd like to explain what has been done so far and what we will be doing today. For the senior session, there were 25 applicants or 25 players that joined, and they were all recorded, and 7 judges made the scoring of the 25, and of the 25, top 7 were selected and went on to the second round. Another round of judging was performed, and today we have the 4 finalists winning through the 2 rounds of judging. The judging was performed just like in ice skating. Each element was scored independently, and then the sum of the score was used to rank the competitor. As far as the size of the material we'll be using, the inner caliber of the simulated artery is 2 millimeters, and the simulated vein graft is 3 millimeters in inner diameter. So this model mimics that of the tibial bypass. The simulator and the graft model was provided by a company called EBM, which is also the company that is helping us transmit this live competition. We are very grateful for EBM. Ms. Kamiya and President Paku. Also, the sutures were provided by Ethicon, and we are also thankful for that. The anastomosis that you will see this morning should be performed alone without an assistant. The order of the performance is in the order of the application, so there is no meaning for the first and the fourth. As I mentioned earlier, the scoring will be performed by the judges, and I'd like to share them here. Can you see my screen? Is it being shared? Okay. So Dr. Kan is my co-moderator. We have three well-known commentator. Dr. Werner Lang from Germany. It's in midnight, but he was kind enough to stay awake and help us out. He also is a good friend of Japanese vascular surgeons, as most of you may know. And he, in fact, came to Japan 2 years ago to help out the distal bypass workshop that was led by President Azuma. Once again, Dr. Lang, thank you for your friendship. President of the ASVS, Dr. Azuma, and also Dr. Fujimura from Saisekai Central Hospital will be helping us out make critical comments on the performance. The judges who will be behind the scene and would not be actively shown on the screen are the following. Dr. Mi, who is one of the top bypass surgeons in Japan from Saisekai Yahata in Kyushu, is one of the judge. Dr. Kodama from Nagoya, Miyama from Kansai Medical University, and Dr. Omine from Hiroshima Red Cross. So these are the judges and the commentators. Now, can you go back to the regular screen? Or do I have to do that on my own? Okay. So with that, oh, one more thing. After all the performance are finished and the scores are tallied, we would like to conduct the award ceremony at the end of the session if we have enough time left. If not, it will be held at 7 p.m. tonight. So for the competitors, please keep that in mind. And also for each competitor, I'd like you to know that the maximum time of your performance should be within 25 minutes. Otherwise, we will move on without being able to evaluate your final anastomosis. Dr. Azuma, is there anything I have missed?
Yeah, that's all. So I'm looking for the meaningful competition. Thank you. Okay.
Maybe I'll have the three commentators and also Dr. Kan introduce yourself. So from Dr. Kan, Werner, Dr. Azuma and Fujimura in this order. Dr. Kan?
Thank you to have this opportunity. Okay. Okay. I'm Dr. Kan from Taiwan. Now it's the president of TSBS. I'm glad to have this chance to be moderator in here. And of course, next year, the SBS will be hosted by us in Taiwan. So I will try to do the repeated good thing in our TSBS, our ASBS next year. Thank you.
Great, thank you. Werner?
Hello, my name is Werner Lan. I'm the chairman of the Vascular unit and the University Hospital in Erlangen. We focus on bypass surgery and have a lot of patients with diabetics and calcified vessels. We do endo as well, but we have a high percentage of distal bypass surgery. And I'm very interested in your education plans and all the training sessions, and I appreciate that I can take part in this meeting.
Thank you. Dr. Azuma?
I'm Dr. Nobuyoshi Azuma from Asahikawa University. I'm hoping this event encourage young vascular surgeons in Asia, very motivated. So I'm looking forward to that. Thank you.
Thank you. Hopefully this will be a tradition, a new tradition in the ASVS.
Yeah.
Dr. Fujimura?
Good morning. My name is Naoki Fujimura, a vascular surgeon from Saisekai Central Hospital. This is the first event, but I'm looking forward to the great competition. Thank you.
Thank you. So let's move on to the self-introduction video from the first competitor, who is Dr. Ichikawa. Can you roll his video?
Hello everyone, and thank you for giving me this opportunity to play in this final round. I would like to introduce myself briefly. My name is Yohei Ichikawa. I'm from Kyorin University Hospital in Tokyo, Japan. I graduated from Kyorin University in 2014 and have been working in vascular surgery division for 5 years under Professor Nukawa. I'm training to be an excellent vascular surgeon. And last year, I studied under Dr. Azuma at Asahikawa Medical University to upgrade my skills in bypass surgery and could experience many cases. I would like to try my best to win the gold medal by demonstrating what I have learned in our hospital and in Asahikawa, my second home. Thank you very much.
I am Masao Nunokawa, Professor of Cardiovascular Surgery of Kyorin University Hospital. It's our great honor that Dr. Ichikawa attends the Distal Bypass Olympic Games in the Congress of the Asian Society for Vascular Surgery. We highly appreciate that Professor Azuma has provided a great chance for him. He is a promising surgeon with excellent surgical technique and great enthusiasm for clinical research. I am convinced that he will make a best performance in the Distal Bypass Olympic Games. Please do the best that you can.
お父さん、手術の大会頑張ってね。絶対に1位で金メダル取ってね。大きくなったら一緒に手術しようね。お父さん、いっぱい指示して、メダルを取ってね。
The Kitatama district of Western Tokyo is home to bustling shopping streets, popular tourist destinations, and establishments retaining the ambience of the ancient Musashino province. Here, one medical institution plays a pivotal role in community healthcare and provides advanced medical treatment for a wide area, including the neighboring wards of Setagaya and Suginami. This is Kyorin University Hospital.
Yeah, Dr. Ishikawa,
Yes.
I think we are ready for your performance.
Okay. May I?
Okay, go ahead.
Okay, I set my osmosis.
No. So he made his anastomosis with the blade upside down, trimming. As Dr. Azuma pointed out, arteriotomy is made first.
Mm-hmm.
So I think that's okay.
That's right. Yeah. So should be checked arterial inside of the artery. Then maybe should be trimming of that correct way, I think.
So, Dr. Ichikawa, can you hear us?
Yes.
Okay, and you can talk, huh?
Yeah.
Well, you don't necessarily have to answer to our questions. We don't want to disturb you. So you can keep quiet. You can keep your microphone on mute.
Okay, I see.
You can turn off the speaker, whatever. Once again, these sutures were provided by Ethicon, J&J. And the training machine called YOUCAN was provided by EBM. Grateful for that. Werner, do you parachute the beginning of the anastomosis like he is doing also?
Normally I perform parachute, yes. I appreciate it because I start with a running suture anyway. So I can see the heel, and I appreciate running suture in this case, and also I always use parachute.
Okay.
At this point. So some of us, they make single stitches in this area at the heel and the toe.
Mm-hmm.
But I also start with the running suture.
But you don't think that one is better than the other, or one is wrong?
No, I think it's not wrong, but I think it's, if you have a single stitch, you cannot see the whole heel, the whole area. In this case, I think it's a bit too much tissue from the vein or from the graft.
Mm-hmm. You mean the bite is too...
The bite is a bit too too far from the edge. Might be it's a problem when you go down.
Mhm. We'll see how the judges evaluate that.
Yeah.
As a matter of
Is
fact,
it 6-0-proline or what is it?
it's a proline.
Proline.
It's 7-0 proline, I think.
It looks a little dark.
Right.
This bite was a little wide, like Dr. Lang was saying. As a matter of fact, Werner, I do a single stitch and I make a knot at the beginning.
Mm.
And I don't use parachute. I understand your point, but I have always taught. And in fact, I worked with Frank Weiss, also with Henry Haimovici. And at Montefiore, the tradition was to do a single knot at the beginning and no parachute.
Yeah, it's absolutely correct. So I think there's no difference.
And also the most important part is the toe, not necessarily the heel. And whether you parachute or not the heel, it's going to be the same at the toe anyways. I think this competitor is doing a good job. It's very calm. Steady movement. I'm not quite sure if he's able to see inside the artery. At least I don't see, I'm not able to see inside the artery as well. Ichikawa sensei, maybe you should move the camera a little bit so that we can all see. Yeah, like that.
Sorry.
So these are also, these things should also be evaluated because it's the Bushido Seishin, and Bushido Seishin, you have to also think of others. You have to have respect to the judge, and if the judge cannot see well, that's an issue. As far as the time required to finish the anastomosis, during the first, second round of evaluation, we have, here we see the point for the heel, 8887. I think the top and the bottom two scores will be deleted, and the middle two will be used as his score. Am I correct, Dr. Azuma? Or are we gonna use all four scores?
Oh yeah, you are correct. So top and lowest score was omitted.
Okay.
Yeah.
So he stuck a needle into the skin, which wasn't too smooth. Another stab in the skin. I think those minor points should also be taken into account. I think the bites are a little too wide, especially near the corner. What do you think, Dr. Kan?
I'm sorry, I missed the question.
Dr.
Fujimura, what do you think?
I completely agree. I think the bite was too much on the corner.
Yeah, it's a little bit, I think the pitch is okay, but the bite is a little too wide. And he took this stitch in one stroke. You cut through. So he ripped through. Now, Dr. Ishikawa, you ripped through the vein also, so you should go back into the vein. That's an artery to artery. He ripped through the vein and went through the artery twice. You made a mistake at the critical point, the corner. Well, that's life. Bad things happen. Maybe Dr. Fujimura's comment saying that the bites were a little too wide made him upset.
I'm sorry about commenting.
No, that's okay, because we always have to perform surgery under a certain stress and pressure. There is no such thing as an ideal environment with no stress. So these stresses also should be taken into account.
So how to recover is also important, right?
Yes, one mistake is okay, and if you can recover, then that might be fine. See, Werner, the point I was making earlier is that even if you do a parachute and you can see inside the artery perfectly, as this competitor is doing, he's not seeing inside the artery at all. So,
Yeah,
so what is the point of doing a parachute if he's not looking inside the artery at the most critical moment?
so in this case, I think it's difficult because in this area, I perform the stitches one by one.
Yeah.
So first the graft
Okay.
and then the artery.
I agree with you.
Because sometimes it's not possible at the toe to have a perfect stitch in the graft as well as in the artery.
Yeah, and also in a diseased artery, there might be a dissection, intimal flap,
Yeah.
and you don't want to miss that. And so as far as I'm concerned, not looking inside and taking the arterial stitches is a pretty critical mistake. He ripped through the vein again. So whenever I make a critical comment, he rips through. Maybe too much pressure on him. Rip through again. Dr. Ishikawa, no vein, no vein. You rip through the vein.
Ready?
No, you're okay, fine, sorry. It was the cut from the prior rip through. So here, I would like to be able to see inside the artery better.
One of the problem is there's no help from a colleague. That's difficult in this area. So normally we have normally we have a person who gives us more help to lift the graft to see inside. That's difficult.
Yeah, but Werner, that's true. But you can take the vein stitch and then look inside and then take an arterial stitch independently, with or without the assistant.
I think it's important to make stitches independently at the toe.
Yeah.
I agree with you that the heel is not as important, but sometimes we have a vessel with a backflow. So I appreciate to have the backflow as well to the proximal part. So the heel is important, but normally the toe is the important area, of course.
Yeah. So there was a pretty low score from the judges on the toe anastomosis, which is understandable.
Another comment from me regarding the parachute technique. If you make two or three stitches, I think it's okay. If you perform too many, it's difficult to bring the graft down. And sometimes you, especially if you have, for example, PTFE graft, you might get larger suture holes.
Yeah,
From pulling the graft down.
I agree. Maybe 3 or 4 parachutes might be enough. One of the judges is saying that it is out of focus. The artery is out of focus. I think the focus is on the skin and not necessarily on the artery. Now, the knot is being made 18 to, so it was about 17 minutes taken. So the judges, please keep in mind that it was about 17 minutes. Now he's gonna show us the inside of the artery. Dr. Ichikawa is 33 years old, so he's like 8 or 9 years in practice. There's a little infold on the near side. There is also some infold on the far side. Little indent on the near side towards the heel.
Toe is good. Right. Looks good, but yeah.
Can you, Dr. Ishikawa, can you show us the heel side? The vein should be trimmed better so that we can see the heel. I mean, sorry, toe.
Like this? Toe. I should cut.
Yeah, longitudinally and show us inside.
Sorry.
Hopefully the judge can see.
I have to be nervous. Sorry.
It's okay. Everybody okay can see it. Now,
yeah.
Dr. Ichikawa, can you take out the yellow plastic outside and then show it to us directly to the smartphone? Maybe that might be a better way. Can you take away? Yeah, that's better.
Judge Omine, please enter the note tie score, please.
I think this is a better way to evaluate the inside.
That's right. Looks good.
Looks good except for the heel part.
That's right.
There's some infolding and a little too wide a bite there. Dr. Werner, any comment?
He's mute. But mute.
Werner, you're muted.
I think the heel is not as good as the toe. So you see, the stitches are too far apart, but the toe is fine.
Yeah. Okay, there are some infold, but I think
that's what I said at the beginning when he started with the heel. So the stitches were too wide. So that's the result of it, I think.
Yeah, I agree. Wide stitch and maybe too many parachute stitches was also responsible.
Yes.
All right.
Dr. Omine, please check your score, please. Dr. Omine,
Dr.
please. Not time.
Fujimura, the irritator.
No, I'm not the irritator. Okay, so I think that's the same comment. The toe looks great, but the heel inside is irregular. I think that's a result of the parachute technique. Yes.
Okay. Well commented. Then we should, in respect of time, we should move on to the second competitor, and I'd like to have Dr. Kan.
Dr. Ohki,
Yes.
please, a little bit. We need a time for all other total score. Please wait it. We are still waiting for the score.
Okay, then Dr. Ishikawa, do you want to make any some comments?
Excuses?
Excuse or comment? What you thought about Dr. Fujimura's stress? Whatever.
We are waiting for composition point.
Okay, Dr. Ishikawa, any comments?
Yes, thank you for all judgment and commentator. Thank you. I was too be nervous.
That's natural.
Yeah. Thank you.
How many times did you rip through the vein during the practice?
In real clinical practice,
No, this YOUCAN practice.
how many times? I practice a lot.
I understand.
Almost,
But how many times?
50 to 60 times.
Wow. And how many
I practice a lot.
And how many times did you tear the vein and the artery like you did today?
This is the first time.
First time. Well, that's life.
Yeah, it's tough
sad.
to do
I'm so sad.
as a performer. Performer is tough.
So we have tallied the scores. Technical points 47 over 60. Composition point 31 over 31 over 40. No deduction. And total points was 78 over 100. So that will be the benchmark for the following competitors. We'll see how it goes. So Dr. Kan, can you take over?
Sure. Our next student is from Masamichi Momoshi. He is from Japan, and his affiliation is Shinsuke General Hospital. He has 10 experience of distal bypass surgery in his clinical. So I think maybe it's good for him. So I think it's time for practice that. So Momoshi, can you have your video?
頑張ってね。複合大会決勝頑張れ。
百瀬先生、頑張ってください。頑張ってください。頑張ってください。頑張ってください。頑張ってください。百瀬先生頑張ってください。百瀬先生頑張って。頑張ってください。会長。百瀬先生頑張れ。
It's nice introduction. Many people.
General Hospital and GK University.
I'm happy and honored to play in this final. I'll try my best to win. Thank you.
Actually, so many people to cheer it up for you. So can you just start from the future?
Okay, this is a technical team. Dr. Momose, I will support you as a zoom in again. So we will reset the camera angle. I will give you a spotlight, okay?
Okay, zoom.
Please stand by. I will give you a spotlight on you now. Just wait it. All right, spotlight on you.
Zoom.
All right, we reset. Okay, fix. Fix.
いいですか?
Okay, Dr. Ohki, everything's ready.
The focus is on the skin, not on the artery.
Dr. Momose, can you do a manual focus?
Focus.
Manual focus. Manual focus means you just touch a screen long time. Hold.
I'm touching.
Hold your fingers for a little while. Okay, 5 seconds is okay. You're using an iPhone.
Okay.
It is totally out of focus. It's on the skin.
All right, again, we do zoom setting.
Dr. Azuma, for the next year's Olympic, I think we should make the skin opening a little larger.
Right.
For the smartphone.
That's right.
For training, I think this is okay. But for smartphone video, I think it catches the skin.
Sorry, I can't zoom.
You zoom with your finger.
Yes,
okay,
now.
wait. Okay, spotlight on you.
Spotlight, okay.
Zoom and manual focus, that's better, yes. But still,
that's okay, I think. If you put something on the artery, maybe
need more zoom, maybe
automatically.
Zoom in better.
Yeah.
Or
okay.
focus. Yeah.
Okay.
Yeah, fine.
Much better.
All right, so I will fix the screen. Okay, fixed. Ready, Dr. Ohki.
Not Ohki, Momose.
Momose, please.
Okay.
I'm also ready, but I have my tools and
oh, really?
I'm ready to perform. If we have extra time, I will do a performance for you. And I'd like to show ideal anastomosis.
So, Momose,
okay,
start?
I'm ready.
Just a start.
よろしくお願いします。
Now, Werner, he's making the arteriotomy in this pro-grade fashion. Some people like to do it the opposite way, like a neck. How do you prefer to make arteriotomy with the blade?
The blade up. I lift the blade.
Oh, okay.
So I'm afraid, if you perform like him, I'm afraid to cut the opposite wall.
But usually in atherosclerotic artery, that is less of a concern.
But I have a small blade and I lift it up.
Okay. So he's making a venotomy right behind you, but that's okay.
Yeah.
Yeah, yesterday we also are talking about how to cut the artery. So most of the commentators said that sharp knife and then lift up.
Mm-hmm.
But one of commentator doing like a similar procedure on this computer.
Yeah. I think there are various styles.
That's right.
In fact, Werner, you know, Frank Weiss is now known for endovascular, but in our days, he was world expert on distal bypass, right?
Yes, yes, of course.
And he always tied the knots once at the beginning, no parachute. And also he cuts the artery in this manner and not upside down. So, I mean, Frank Weiss was very meticulous. Every time the resident takes a stitch, before the resident can pull out the needle, Frank Weiss will say, stop. And every time the needle is like penetrating through the artery and you have to stop. And then he takes a look inside and then allows to thread it through. Every single stitch, he goes, stop, stop.
Well, that's the most important part of the whole surgery is the anastomosis. So,
yeah,
yeah, it's very important. So normally, if I perform the surgery not in the model, but I use holding stitches because it's very difficult to look inside the vessel. So you have to take a forceps and every time to get into the vessel. So I make a stitch in the middle of the artery.
Oh, okay.
To every side, so I can look into the vessel all the time.
I think this performer is using the left hand adequately to look inside the artery. I also pay attention to the left hand of the operator. Often junior operators only use the right hand to operate, but they should always use both hands. I saw many of single-handed operator during the first round of evaluation.
So this technique is very precise, so one by one.
Making sure that it doesn't infold. I think that's a good.
Yes.
Now, if you parachute, it's difficult to control the infolding. But if you do it one by one, you can make sure that you prevent infolding every stitch. Dr. Fujimura, feel free to apply pressure.
That's why I'm not speaking.
So changing the view from like inside outside, like he's doing here, I think is pretty dynamic, and I think that's also good. Not just doing it from one particular view, but changing depending upon which side you're doing. I think this dynamic shift is also important. Oh, he's not holding the artery, and I think that's a good move. If you pinch the artery, it should be a no-no. So using one side of the forceps to open up the artery, but not pinching it. So I think comparing the first competitor and this one, we can see the pros and cons of parachute versus single knot. The parachute is easier and faster, but you have more control over a single stitch doing it in this manner. So there's pros and cons, I think.
Yeah, whichever you preferred, but it is sometimes tough to see that even the very manipulate the vein and artery. So it depends on the situation, I think.
Yeah, I totally agree. So he has placed several stitches on either side. Nice view of the inside.
Yeah, that's right. That's agree. Yeah. He tried to see inside every stitches.
Yeah, I think that's a good principle of distal bypass.
Yeah,
that was one of the critiques towards the first competitor doing the toe, where he was not necessarily watching inside. Whether you see or not, I think is important, but also whether you pretend to see or not is also important.
Yesterday, in junior class, the last three judges are commenting. Judges made a comment.
Yeah.
Every judge say that the most important point of the toe was whether the competitor looking at the inside.
Yeah.
That's a big issue for them, for judges.
I think every vascular surgeon would agree on that. I like the fact that he's making sure that the graft is not infolded.
Everting,
yeah.
Outside, yeah.
Dr. Khan, what do you think?
It's good, but actually I'm using the parachute.
Okay.
Yeah.
I think majority prefers parachute. Maybe next time I'll try the parachute in a difficult situation.
Yeah.
That's agree. Yeah, that's mean. It makes sense.
I think the bite and the stitches, bite and the pitch is adequate. Dr. Fujimura, why don't you apply some pressure?
Me? I think he's doing so far great, so I have no comment yet.
So how about I'm sorry, how about the shape of the vein graft? Especially toe side. What do you think?
I think he could have trimmed more. It's almost like a rectangular. We'll see how he adjusts it.
Yeah, that's right.
So I think for the big arteries, I think this is okay. But for the small tibial arteries, I think he should have trimmed the graft more.
But lesser is better than excessive.
A bigger toe is excessive, but shaping too much sharp is we should avoid that.
Yeah, because it will narrow the toe.
That's right.
So I agree with Dr. Fujimura's point, but if you have to make an error, I would error on the too larger side.
That's right.
Because you can adjust at this point in time. And if you have excess vein overlying on the artery, outside the vein artery, I don't think that's too much of an issue. We'll see how he does this one. So it's a rectangular vein and how that fits on the artery. If he takes a wider bite on the vein and adjusts, I think that would be okay.
Yeah.
Most of the time, I will bite more to let the vein fit on the artery. A little bit of bite, big bite. I think will be better.
A bigger bite on the artery?
On the vein.
On vein.
Yeah.
So this is, we call this Moccasin technique, like shoes. The outer curve is different from the inner curve.
What do you mean by that?
We call this Moccasin technique.
Moccasin. Okay, Moccasin.
Yeah.
Well, he's looking inside the artery. Well, that I think is the apex of the anastomosis. I think he's coming around the corner quite nicely. We'll see if he shows us the inside. So this is apex number 2. The way he uses the forceps, opening the artery, I think is good. That's what I was talking about, single-handed operation versus both 2 hands. Coming around the corner quite nicely.
Yeah, he avoids trauma to the intimal layer. That's good.
He's not pinching the artery. So Dr. Fujimura, as far as the trimming of the vein, I think it's coming out quite nicely, equally spread and fitting the corner quite nicely.
I agree. Yeah, I think his technique is good.
If you have a wider vein, you are able to place more stitches around the toe so that it can spread open. So once again, I think a narrower vein is worse than wider vein. Adequate, appropriate or adequate, I think is best.
So I personally like the wider graft, wider vein graft, but for the beginners, I think it's sometimes difficult.
Yeah, because of the mismatch between the artery and the vein, it can be difficult, and it will require many more stitches as he is doing right here. If you have many stitches, then you can adjust the discrepancy. And if you can do so, then it would result in a wider, larger toe.
Yeah.
Oh, that's quite a nice toe. I wonder how many people are watching early this morning. This is being recorded, right? If you can show an archive to the rest of the members, I think that would be nice. Dr. Azuma, are you planning to show an archive? Oh, Dr. Azuma left.
All right, this is a technical team, Park speaking. Actually, this is broadcasted on the YouTube, so and also archive is published.
So
So
this is at this point in time broadcasted on YouTube.
Correct.
And do you know how many people are watching?
Now it's a 58.
Okay.
So the toe is fine. We say it's a Roman arch.
Roman arch.
not an
like
Gothic arch. Yeah.
Roman arch, I think, like a clock. 11 o'clock, 12 o'clock, 1 o'clock. We have 2 more competitors left and 80 minutes. So I think we're doing fine as far as the time is concerned.
Don't you think the bite may be too big here?
The vein bite, the last one was a little too large. Yeah, I agree.
So I need to put some stress. So I need to comment something bad.
If it's on the side of the anastomosis, I don't care as much, but consistency is also important. See, this competitor was very careful around the toe and the heel, but along the side, he's taking a fairly liberal bites with a single stitch. And I think this shift of technique, I think is also good. I mean, you have to be careful around the corner, but you can speed up a little bit along the side. Dr. Werner, do you agree with that?
Yes, absolutely. It's not necessary to make a double stitch in the middle.
No,
it's fine. Good technique.
Especially if you have stitches on both sides.
Yeah,
it's time consuming and sometimes harmful to try to see inside. So if you have 2 stitches, you might as well apply tension and take a single bite.
ありがとうございました。
Nice job. So we should check the inside.
Okay.
Please open it. Yeah, I think the inside is okay.
I think you can see the difference between the first one where we saw the infolding.
Yeah.
But here you see a nice inversion.
Oh, can you check, open the heel and the toe? Maybe we can see much more. I think it's good.
Yeah, that's good.
Yeah, that's good.
Sorry.
Werner, do you have any comment?
Okay.
So
Okay.
we will wait for the scores to be tallied. I think this competitor placed more stitches than the first one, and I think that translated into the time. The first competitor took 15 minutes, and this one was 20 minutes.
Okay.
Now, Dr. Khan, do you consider the difference between 15 minutes and 20 minutes a clinically significant difference?
Of course, I concern it. Of course, I concern it. I actually I would like the best is the time is shorter and the stitch is good. I think we should consider the balance between that.
Yeah.
I don't know. How about your opinion?
Well, if it's like 1 hour, that's too long.
Yeah.
But as far as it's within 20 minutes,
I think it's okay. Just
yeah. When we evaluate the anastomosis, the time factor is a minor point.
Yeah, sure.
Now we're looking at the arteriotomy 8.5 heel, 8.5 toe. I think he scored quite well on the toe, the other side. So on average, he did well throughout. No deduction. Dr. Fujimura, any comments on the scores?
Great technique, and I think it's showing on score.
Mr. Paku, can you show the score for the first one?
All right, 1 minute, please.
So regarding time, so I think that the accuracy is much more important compared to time.
Yeah.
Because accurate anastomosis maybe last a long time.
Yes.
I mean, influence a long-term results. So 4 years or 10 years or more. So it's an important thing.
Yeah, and also I totally agree with that. And also distal bypass might take 5, 6, 7 hours, and 5 or 10 minute difference within a 6-hour operation really doesn't mean anything. So this one was the first one. He scored high on the arteriotomy, but had some issues with the toe, like we saw. He ripped through the vein. I think that was the cause of the severe score on the toe side. Other than that, heel was good. Other side was good. And oh, there was some deduction. I missed that. I'm not quite sure. Maybe we'll ask Dr. Omine. Omine, what was the cause of the deduction for the first performer? Or maybe we should ask that later because it might not be fair. Okay. Right. Then, Dr. Mamose, thank you very much. We'll move on to the maybe we'll have a comment from the competitor at the end. So the third performer is Dr. Pan from, I guess, Taiwan.
From Pinzhou.
Fan, Dr. Fan.
everyone, I'm Ping Chaofeng from Taiwan. I work in Chang'an Memorial Hospital as a vascular surgeon. I love kendama. After the busy clinical works, it makes me relaxed.
Whoa.
I think playing kendama is like doing surgeries. Both of them need stability and accuracy. You have to practice again and again to make perfect at all.
He's a performer. Interesting.
Hey, honey. Here comes the finals. Hope you do your best. I'm always here to be with you. Love you.
Hey, bro. I heard that you get into the final round of Distal Bypass Olympics. I'm here to support you and wish you luck. お兄さん、いつでも応援してるよ。バイバイ。
Hey man, I heard you enter the final round for Distal Bypass Olympics. What a nice job. And I hope you can keep fighting for the finals, and I believe you can do it. Go!
I come from Taiwan, a beautiful island with many wonderful sceneries. Taiwan is also famous and popular for many kinds of delicious food. I work in Chang'an Memorial Hospital. It is the biggest hospital in Taiwan, and the number of beds is the secondary in the world. I got my training at Chang'an Vascular Department. It is the first vascular department in Taiwan. We focus on all kinds of vascular surgeries day and night. It is my pleasure to introduce our hospital to you and wish everyone healthy and welcome to Taiwan after the pandemic. Thank you.
Dr. Fang, this is Dr. Ohki from Tokyo.
Hey, hello, Dr. Ohki, Dr. Ken.
Hi.
Hello.
Thanks for joining us, and we are looking forward for your performance.
Yeah, it's my pleasure to be here.
I think the judges already have a good impression on you because of the kendama.
It's my hobby, yeah.
I think the kendama is more difficult than a distal anastomosis.
Yeah, sometimes.
So we'll see how you do. You can start your performance.
So
please to
support you, Dr. Fan.
refocus.
So I'll give you already spotlight is on you. So can you zoom in, please? Flip, come back, zoom in. All right, and we fix the angle. Yep, can you adjust it? Yep, for judges. You have time.
Looks good.
Okay.
All right, we fix. Okay, screen is fixed. Now, spotlight. Okay, ready.
So I have to start?
Sure.
Dr. Fan is from Taiwan, and he is 36 years old. The first one was 33 years old. The second one, 36. This one is also 36. The last performer is also 36 years old. So, well-seasoned vascular surgeon. Looking through his resume, I realized that he has only done one distal bypass. So Werner, this is his second distal bypass.
Good. We are looking forward to watch him.
Now, one thing that you might not know is the fact that in Taiwan, well, if you move the field too much like he's doing, I think that could be a point of deduction. One thing that's unique about Taiwan is that there is no such thing as a vascular surgeon. It's all cardiovascular surgeon, or mainly cardiovascular surgeon. So they do cardiac and vascular together, or not together, but both, which means that vascular is kind of put aside. And not too many surgeons in Taiwan routinely perform distal bypass like you do. Very few. Dr. Kan,
Yep.
Am I correct?
Actually, we have most of the surgeon is coming from the cardiac surgeon.
Yeah.
But I think Chang'an Hospital is another special site because they have the many surgery just focus on the vascular surgery. So I think Dr. Fong is he is a vascular surgeon, pure vascular surgeon.
Okay.
And most of the hospital, because the distal bypass done, the surgery done is not so many. So actually, in my data, we have only 8% of the distal bypass surgeries for our limb ischemia.
Okay.
Yeah. So we encourage all of the people in doing the distal bypass. So I just discussed with our government, we will raise the operation fee for triple times for to encourage the people, the surgeons to do the bypass surgery.
Okay. So Werner, increasingly Taiwan surgeons are becoming vascular dedicated, but it's like developing and not quite there yet.
Yeah.
But I think they will have enough patients for that, huh?
Yeah, I think so.
Yeah, we have lots of patients, but because actually before we have the surgery, just not so good outcome. So many of the people they done the endo. Male surgeon do the endo surgery. So we are trying to correct this concept to do the bypass.
Yeah, similar issue in Japan.
Yeah, I think it's normal if you start with cardiovascular. So it's a different kind of surgery, and most of the cardiovascular surgeons, they don't like the peripheral disease, and the patients are rather different from the cardiac patients, and also the material and the vessels. So I think it's difficult to make both with a equal quality.
Yeah, sure.
I agree. And if you do both, then naturally priority will be given to cardiac.
Yeah,
that's right.
That's
Definitely,
also
I
because the reimbursement might be better. So it's the same in many German hospitals started with cardiovascular and general surgery. So vascular surgery is independent, maybe 30 or 40 years, but not at the beginning. They started from cardiovascular or from general surgery.
But in Taiwan, we have the big issue is our background come from the cardiovascular surgery. So the cardiac surgeon always think why we go out to do the vascular. Yeah, and so that's our fight. They don't. Our government did not recognize the vascular surgery just a subspecialty.
That was a big bite.
Yeah, that's right.
Yeah, that's the too big.
That was a very big bite, and
Yeah, too big.
It influences the shape of the heel after the finishing of anastomosis. Sometimes, kinking or narrowing.
yeah. And also not looking inside.
Yeah, not looking inside.
That, and also that's a big bite.
And
it's nicely averted, but nonetheless, it's a big bite and a blind shot. He's holding where he wants to penetrate. See, this is what I was saying earlier, operating with just one hand. He should use his left hand more effectively.
Yeah.
How about magnifying lenses? How many use it?
I use a 2.5.
Yeah, me too. I like 2.5. It's not so heavy. It's comfortable to wear, and
I'm wearing 3.0 or 3.5.
That's good.
Because better seeing is for maybe result in a better outcome, especially in a very maybe paramalleolar or inframalleolar artery bypass.
How about using the big microscope like the brain surgeons use?
It takes time and it's a narrow field, so
narrow field, yeah.
Yeah, you cannot control all of the surgery.
Yeah, and also very limited view angle. It's kind of fixed. You can't.
Yeah, that's right.
The neurosurgeons take big pride on using that microscope, but I think they are silly because it's a fixed view and you cannot like move your face to like see inside, outside, which is absolutely necessary. And they use, Werner, the Japanese neurosurgeons, they use that big microscope for carotid endarterectomy.
I think that's not necessary. So 6060 looks like a rope in this microscope.
Well, one of the reasons is that in Japan, if you use a big microscope, you get additional reimbursement, which is a silly rule, but that's one motive for them to use a microscope every time. You know what? What's interesting? Frank Weiss, he never uses a microscope. I mean, a loop. He does it with bare eyes. And he always, when a resident wears a loop, he would complain.
Really?
He was against using loops because of the narrow view, and that you would like make a mess outside the field of view. He always said, do it with your naked eye, and if you can't see, you put your face close. that was his teaching.
So that's why some remove their glasses when they perform the anastomosis.
Yes.
Like for me, it's too close to the wound.
But maybe time is different. So now loop is good.
But it was only like 10 years ago when Frank Weiss was against the loops.
Really?
Yeah, only 10 years ago. And when I was in New York, he was against loops, and he didn't criticize me using loops, but when the residents use loops, he always said, why do you need the loops? You make a mess. You tangle the sutures if you use loops and so forth. Dr. Fan used his left hand nicely around the corner there. Dr. Fan, you move the patient too much. You should move instead of the patient.
So he also didn't cut the ear of the graft.
Oh, the vein. Oh, okay. I think the judges were seeing that, and appropriate deduction might be applied. Yeah, looking inside the artery.
That's right.
That's good.
At least toe and heel, we need to see inside of the artery.
Yes, very critical. Dr. Fan, you might want to place the patient straight.
This cell phone to
So our commentator, you know.
So sometimes in Germany you have very fat people, and it's very difficult to dissect and to find the deep vessels.
Yeah. As a matter of fact, Werner, when I was in New York, I have never performed a peroneal bypass from the medial side. I always came from outside, took away the fibula, and then found the peroneal artery. But in Japan, I have almost never gone from the lateral and always from the medial, and that's because the patients are thinner. It was very difficult to perform a distal anastomosis in a fat patient, big leg, through the medial. Dr. Fan, did you trim the vein or not?
No, I don't think.
Yeah, I trimmed a little bit.
Okay, you did trim it. You pretended to trim. Because I don't see the trimming.
Yeah, I don't see the trim.
But that's okay. Dr. Fan, you spoke Chinese? I guess you spoke Chinese. You know, speaking to yourself during surgery is considered deduction. Like saying, ow, oh, wow, oh my God, kind of.
Yeah.
And that is part of the Bushido mentality. You keep calm, quiet, and do your job. You know, I kind of think that the first competitor is advantageous compared to the third or the last. Because if you have to wait like 1 hour before your performance, you kind of get nervous, I guess, as opposed to the first one. I'm not sure. The advantage of the latter is that they're listening to this so that they can incorporate these techniques or hints into their performance, like not move the patient or eversion versus infolding. But I'm not sure. If you have to wait like 90 minutes, I think you can, it's enough time to get nervous.
I think the first or the last will have some benefit to see the tricks, but the time is also past your patient is losing.
I think it's very difficult if you have your regular way to do it, and if you see others perform in a different way. And
Yeah.
if you want to change your technique in a few minutes, I think it's very, very difficult.
Yeah, I think.
So I think better keep your technique and follow your technique. And
well, Werner, I think that's an excellent point. I think you should stick with your philosophy. You should stick with your regular performance and not do something special just for the sake of the competition.
Yes.
And I think we made that point clear early on that even if their style is not the same as the judge's style, that should not necessarily be a point of deduction. We have to respect different ways of doing anastomosis, and not necessarily diversity, but I think there's not a single correct way to do so. Now he changed to backhand. I wonder why he changed to backhand here. He's going outside in on the artery at the heel, which is not a good thing to do. Outside in on the artery at a very important point. Werner, what do you think about that move?
I wouldn't do it because sometimes you might get any plug dissection.
Yeah.
Yeah, you could lift the intima. I wonder why he changed the direction right there. That's a very generous bite.
I think maybe it's because his first stitch in the middle, so maybe.
Even if it's in the middle, you can go inside out on the arm.
Yeah, I think so. Yeah, yesterday also one competitor are doing some stitches by like this artery outside in. Then also Dr. Conte or other commentator, all of them are against it. Yeah, that's a rule, principal rule for the vascular surgeon.
Yeah, I'd like to ask Dr. Feng afterwards why he made that move.
I think you can do it in a really healthy vessel.
Yeah.
I think nothing will happen, but if you have an atherosclerosis, I think it might become a problem. And here now you see a narrowing at the heel.
Yeah,
that's the big bite.
Good pickup. I think there is a narrowing there. And also the toe is not the Roman arch.
No.
Okay.
It was difficult to fit the shape because he didn't cut or trim better way.
Yes.
Yeah, I think that toe might bleed if it's a real patient.
Yeah. So that's bleeding, right?
Dr. Fan, do you think that toe will bleed, or are you confident that you'd achieve hemostasis?
I think maybe I can check inside to decide.
Okay. You know what I'm talking about. The very apex.
The problem is if there is any bleeding, you have to perform an additional stitch, and this is very difficult to perform.
Yeah,
because
you have to do it blind.
It's a blind. It's blind. Yeah.
Yeah. Can you keep still, Dr. Fan? Okay. The far side is a fairly generous pitch. I think the pitch between the near side and the far side is a little different. wider on the far side and more meticulous pitch on the near side. Can you, Dr. Fan, can you lift the apex of the vein? Is there a space there? Yeah, it seems like there's a gap there. That's one point of the anastomosis that you don't want to miss. I think you should take more bites, more stitches around the corner, so in order to avoid those gaps. But we appreciate you joining from Taiwan, and it certainly added international taste to Olympics, and I thank you for that.
Thank you.
Dr. Fan, any comments?
A little bit nervous, and thank you for your comments, Dr. Ohki and Dr. Ken. Hope I will do better the next time.
Yeah, no patient was hurt today.
Yeah.
So, hopefully, you would incorporate this in your future surgeries and become a better surgeon. But good performance, and you did it within 19 minutes, which is totally appropriate. And hope to see you next year at this Olympic.
Yeah, nice to see you.
Okay, we are waiting for the score tally.
Yeah, the score has been shown.
Like I said earlier, there was 27 entries in the senior class. And this is the top 4 out of the 27 entries. Some of the 27 might say, I was better than him or her, who might be watching today. I'm sure there are some competitors that were kicked out earlier complaining about some performance today. Can you show the score once again?
I think pre-recorded is much more easy than live. So
absolutely. I think you are absolutely right. Dr. Fan, I think he performed a little better during the recorded session, but that's life. This is reality. So Dr. Fan, you did well. Maybe you should train your heart.
Yeah, sure.
So, Dr. Ken, can you take over for the last?
Sure. Last one is Mia Shiozu. It's from Japan, Nihon University, Isbashi Hospital. He is also doing some vascular and cardiac surgery.
She.
Oh, she. Oh, sorry.
Yeah, lady.
Oh, yeah. Sorry. There's no gender in here. Okay, sorry. So maybe Mia, could you please to start your future, Mia?
Yes. Hello everyone, my name is Miyoshiru Uzu. I'm a member of cardiovascular surgery department in Nihon University Itabashi Hospital. I'm from Tokorozawa City in Saitama Prefecture. I graduated from Yokohama City University in 2010. After graduating, I worked in Shonan Kamakura General Hospital for 7 years as a resident. After that, I moved to Sagamihara Kyodo Hospital, and now I'm working here for 2 years, and I experienced 3 distal bypass this hospital. In my free time, I'm into scuba diving. Thank you. When I received the final game email, I was very surprised, glad, and very excited. Thank you to everyone that has supported me and continues to support me. This contest is bittersweet for me because it is the first and final game for me. It's the 12th year of my career, so this is the last game I can compete. So I'll do my best and I'd like to enjoy it. Thank you.
白先生頑張ってください。白頑張れ。目指せ金メダル。白先生頑張ってください。
She had any experiences with open and endovascular prepared their coronary bypass and endovascular surgery. Moreover, in this time, she liked to have I'm hoping that she will be more and more successful from now on.
白津先生頑張ってください。白津先生頑張ってください。白津先生頑張ってください。頑張ってください。応援してます。
はいと。
せーの。頑張れ。頑張れ。
頑張ってください。
Okay, Mia? Are you ready?
Okay, this is Yang speaking. So, okay,
Did
I
you-
will support Dr. Shurizu. I will support the camera setting again. Okay, I'll give you now. Spotlight is on you. All right, flip to the side, flip the screen to the side, and yes, and zoom in, please. Flip back, zoom in. Okay, flip again. Right or left side, please check the direction. Flip the screen, coming back. Yes, and zoom in. Yes, you're right. All right, now I fix the camera. Yep, it's fixed. Okay, Dr. Ohki is set up as ready.
All right, Dr. Kan, it's your turn.
Yeah, I think it's time. Mia, you just start.
Yes.
Werner, how do you think things are going so far?
So that's the way I perform the anastomy. So I agree.
No, I'm talking about the session in general. This, this competition.
It's great. It's
You
great.
like it?
Yes. And everybody has really does a good job, and I think it's very difficult. So some experts watching, and everybody is watching, and you are nervous.
I think you are a kind person, unlike Dr. Fujimura. Very kind.
Thank you for the comment.
I feel bad for the first performer that ripped through the vein after Dr. Fujimura's criticism.
That's life, right? That's life.
That's life. Yes, absolutely.
Yeah.
There's always stress and pressure during surgery. Her venotomy trimming was very aggressive.
Yeah.
It's a fairly narrow. Oh, she pinches the vein like that, huh? Interesting. I am a little concerned about the narrow vein at the toe side. We'll see how that goes.
And I think she has trimmed that a little bit on the toe side. It's okay, I think.
Werner, what do you think about the narrow vein?
I think we will see at the toe. I cannot. I think it's possible, but it makes it more difficult.
How about your style?
Pardon?
How about you? Do you trim the vein that narrow or wider?
No, wider. I like wider.
Yeah, I think many would agree with that. How about you, Dr. Fujimura?
Same, wider vein.
Because earlier you were saying a little too wide, but this one.
Yeah, I think it's just it's too much.
Too much. How about holding the vein with this clip? Is that okay? I'm not sure. I'll leave it up to the judges. But it seems a little like
aggressive,
unusual.
But it's not in the rule book, I think.
So Werner, you were saying that the first performer had too many parachute stitches. I think he was placing like 5 or 6. We'll see how many she places. Maybe I'm affecting the performance too much. See, if you were to parachute, you might as well see inside the artery more, because otherwise you're not taking advantage of the parachute technique.
Well, one reason for the parachute technique is
no, sorry. See, she's not looking inside here, and if you are parachuting, you might as well look inside. Sorry. She was pinching the vein, but I think that's okay.
Yeah, I tried to use other material, but in this situation, it's difficult to pinch just the adventitia.
Yeah. So once again, here she's placing a blind stitch, and you might as well open the artery and look inside. Okay, like that.
One more comment about parachute. One advantage of the parachute is that you can bring the vein down very smoothly if you have a very thin vessel.
Yeah.
A thin tibial vessel, and you make one stitch, so the force on the stitch is very high. So if there is any trouble, maybe like this, you get a tear of the vessel.
That's what you were saying earlier. Too many
Yeah.
parachutes.
Yeah, she should.
Yeah.
Okay. Looks okay. Yeah.
Yeah, but now you have a problem with the proline. You see, it's
you can see the tension applied to the proline.
Tension, yeah.
So I think 3 or 4 parachute stitches is appropriate.
Yes.
She made like 6, and maybe 6 is too much.
Yeah, a little too much.
And always after I did the parachute, I check the inside of the parachute at heel. Start taking down. So I'm checking all files is okay, both vein side and arterial side.
Yeah, I think that's one pitfall of the parachute. You have to look inside as you pull down the stitches. Otherwise, you might as well do it one by one.
And if the parachute is not tight enough, you might have a bleeding at the heel.
Yeah, that's something we experience with the aortic anastomosis quite often.
Yeah. And this is very difficult to repair.
It is. How do you repair that, Werner?
I think you have to clamp again, and
that's bad.
It's bad because in most cases you will get some kind of narrowing at the heel then.
Yes, and that is precisely the reason why Frank Wies makes a single knot at the beginning, because he doesn't like to have the bleeding, but also he doesn't want to apply too much pressure on the heel side. So there are pros and cons of doing it either way. I think that was a big bite there. Oh, okay. She adjusted. Still fairly generous bite.
Another technique is continuous suture and five stitches, single stitches at the toe. So some do it. They go around almost
that was
the whole anastomosis, and they perform single stitches at the toe to be more precise.
I'm doing that. I'm doing 3 single stitches on the toe, especially in the paramalleolar or inframalleolar artery.
So I do the same. I place 3 stitches on toe, but in this game, nobody seems to be doing it. And I was wondering why.
Yeah, it's a game, so maybe it takes time to do that.
Yeah, and also they also watched Dr. Azuma's video, and I think they are trying to mimic that.
Yes.
Now, I do have a problem with the big arterial bites. Even though it's on the side, I think it's fairly generous, big bite. In fact, I was worried that she was taking the fat tissue behind. So now she comes to the critical part. We'll see. The vein, I think, is nicely everted. Now that was a blind stitch. It would be better if she
lift up the vein, right?
yeah, picked up the vein and tented it towards the other side. Unlike what she's doing here. So this is a critical portion, and why parachute if you are doing a blind toe stitch? She should elevate the vein, pull it towards the other side, and look inside.
So you mean she didn't do the merit of the parachute, not stay suture, right? So
yeah,
that's a merit. She's supposed to see the inside of the artery.
Yeah, there's another blind stitch. She's taking, I mean, she should thread through the vein and have a complete freedom of the needle here, because this is so important. The needle went through the vein and the artery at once, but a little gap there. Now, so that's the apex.
So next one is very important. Yeah, that's right. So
yeah, this is a move that I wanted to see earlier, before the apex. Oh, she's taking out the needle. Oh, she didn't like that.
I think at least 3 stitches on the around the toe is very critical.
Yes.
So you need to see inside maybe.
She's having trouble. Okay, she tried to go through the vein twice, but now she changed. I think this stitch is okay. She's applying appropriate tension and seeing inside of the vessel.
Yeah.
But once again, the vein is a little narrow, and you have to be careful to take very small bites on the vein side. Otherwise, you can create a narrowing.
So yeah, so second one, the third one are two broad toe, but this are little narrow one. But she did care that the top of the vein by trimming, but trimming are a little bit small.
Yeah, I agree.
I think the bites at the toe are too far. Now you see, now they will narrow, and I think the vein is okay, but in the artery they are very far from.
Good point. Yeah, I think the vein is wider than I initially thought, but the bite and the pitch on the artery side is not perfect. She might cause narrowing there. Now she switched from backhand to forehand, which I think is a good move. Now that was a single stitch, and I think it was premature to go to a single stitch, because the last stitch was like 1 o'clock and this one was 3 o'clock. It went from vertical, horizontal to vertical. Unlike Werner said, it wasn't quite a Roman arch. I think it would be better to gradually go from horizontal to vertical. I think it's okay to take a single stitch here, but the previous two, I think would have been better if it was independently taken.
I agree.
As far as this YOUCAN model, which was Dr. Azuma and EBM's co-production, I think it's an excellent model. I have one YOUCAN here, which was a gift from EBM. And I did it myself and I liked it very much. It's very delicate. Werner, have you tried this YOUCAN and this plastic model, which the competitors are using? Have you seen it?
I've seen a prototype, maybe.
Yeah, so this is this can be holding, then can be centered in the envelope. But Dr. Werner attended a distal bypass workshop 2 years ago. At that time, the classical type of the tamate bag already he knows very well. But
I think you have improved a lot, so it's very nice now.
Now, sorry to interrupt. She immediately started to make knots, and I prefer that she would apply tension and make sure that it's not too loose. I think one should be a little bit more careful before making knots. In general, I think the near side appears to be a little loose because of that. The cutting of the suture, I think, is a little too short.
Right.
Yeah.
Yeah.
I prefer 5 millimeters.
So regarding a material, yesterday, Professor Conte are very interested in that material itself.
Yeah, the material is more critical. Yeah.
He asked Dr. Park, what kind of material are you using like that?
Dr. Shiromizu, yeah, take it out and oh, the patient dropped from the bed.
Dr. Omine, please check the other side score, please.
There is a little infold at the heel. And I think that might be a result of placing too many parachutes. Instead of 6, it might have been better with 3 or 4. So that kind of a gap or infold resulting from too many parachute stitches. Overall, there is it's all everted, and I think it.
Yeah, that's right.
Yeah.
Berg,
okay.
Dr. Omine, please check the score of the other side, number 5 at the other side, please. Thank you.
Looks a little loose, and but overall, I think it's a good anastomosis.
Thank you.
You did well, Dr. Shiromizu. Congratulations.
Congratulations. Yeah. Thank you for a good job.
Thank you. Thank you very much.
Did you feel pressure? Were you nervous?
Very, very nervous.
Yeah, because agitator Fujimura was
I only commented 3 or 4 times.
No, your presence.
Thank you.
So we are adding up the scores. We'll see how, see knot tie. Dr. Shiromizu, I think your tying itself was okay, but you should have applied a little bit more tension and made sure that it was not loose and so forth.
Yes.
I think that was a point of deduction. I'm sure in real life you do it that way, but I guess you were a little pressured or nervous.
Yes.
But at the very least, you are the finalist, and at the very worst, you get the bronze medal. So
Thank you.
no complaints, no moaning. Total points 73. I think that's a very competitive score.
Thank you.
I forgot how the others did, but Mr. Park, can you show us the overall scores?
Yes. Firstly, I'll give you a details of the score of the Dr. Shiramizu, okay?
Yes. Maybe you can make Dr. Khan and my face a little bigger. Here's the individual scores. Arteriotomy, Dr. Kodama, you gave 7 for her arteriotomy. What was the problem?
So, can you hear me?
Yeah.
So the penotomy is not so good because of the narrowing the tips. So I included the score on penotomy.
Okay.
Arteriotomy.
I got it. So the preparation was a little needs some improvement. Dr. Omine, you scored 6 on the toe. Why was that? Mute になってる? じゃあ、Dr. Mi, you gave a 6 on the toe side. What was the reason for the deduction?
Yeah, it's looks like just too narrow.
Too narrow.
Yeah.
Yeah. So I guess that's what Werner was commenting also. So what's interesting looking at this score and also others is that the judges' scores are very evenly distributed, and there's not too much discrepancy among judges. Now, Dr. Kodama and me, Dr. Mi's arteriotomy, 10 versus 7, is an exception. It's unusually wide, but Mr. Park, can you show us the first performer?
Okay, first performer's details.
I was looking at the discrepancy between the judges, but very little discrepancy, which means that the quality of the judge was very high. And I think that owes to the fact that the judges had 5, 6, 7 hours of reviewing the anastomosis through the first round and the second round. And during those hours and hours of judging and discussion, I think the judges came to a fairly uniform criteria. And you can see that here also, the discrepancy between each judge is very narrow. The largest gap is probably toe side. Toe side, Dr. Mi gave 5 and Dr. Miyama gave 8. But other than that, there's only like one point discrepancy, which is quite amazing. I think the judges put a lot of time into this effort, not just today, but in preparation.
That's right.
And I think that is shown on the scores. Can you show the second performer?
second performer.
I'm trying to see the standard deviation among the judges. It's very small. Here, once again, there's very little discrepancy, and this is a direct proof of a high quality judge. Werner, any comments on this scoring?
No, congratulations to everybody, the judges as well as the participants. Really good job. I enjoyed this so much, despite it's very early in the morning. But I don't feel tired. It's so amazing. Great job, everybody.
Thank you. Thank you for your nice comment. Dr. Kan, well,
Yeah.
Can you show the third performer? So we're talking about the
Third performer.
The uniform judge score or the little discrepancy among judges. Don't you think that this is a proof of the quality of the judge?
No, I think the section judgment, they will change by time. So I don't think that's a big problem. And we can make sure. I think that from that there will be the time problem. When you see the first one maybe your standard, and you see the higher, the next will be lower. I think you don't to worry about the discrepancy. I don't think.
Yeah, I mean, it's very uniform. Even here, there's not too much gap between inter-observer differences. So I congratulate all the 4 judges. Thank you very much. The judges performed equally well. That's my thought. Now, I think we are right on money. We have 5 minutes left. I think the chairmans did a good job too. So, Dr. Azuma, we have 5 minutes left. So maybe we can go on to the award session, ceremonial award ceremony. Is that okay? Okay. Wow, big difference. It wasn't. Okay, thank you very much. So it wasn't a close call. By a fairly wide margin, Dr. Momose from Shinyurigaoka Hospital is the gold medalist, the first gold medalist of this Olympics. Hopefully in 10-20 years, this tradition would continue, and he will be memorized as the first winner. Dr. Ichikawa, who was the first performer, was 77, silver medal. Miss Shiromizu, 73, bronze medal. And Dr. Fan from Taiwan, well done, bronze medal. You're not the last of the 4, but you were number 4 among the world. So you don't have to feel sorry for being number 4 in the world. Maybe we'll have a short comment from each, starting from Dr. Fan, then towards silver and gold. Mr. Park, can you give their face?
All right, so Dr. Penn, everybody, all participants, can you make a selfie mode, please? So we do some hero interview, okay?
可有裤子的样子。
Let's go from Dr. Fan.
Selfie. How to?
All right, everybody, this is a Dr. Penn's camera. Okay, Dr. Penn's on.
Hello.
Hey.
Hey, I'm Ping Xiaofen from Taiwan, and it's my pleasure to be here to have this opportunity to do the anastomosis from a lot of audience and on the live stream. So it's very special experience. And thanks for the moderators, Dr. Ken, Dr. Ohki, and for all the judges. Thank you for your comments. I'd like to thank my parents and my brothers and my lovely wife. I love you. Thank you for your wonderful video. And I will take this experience and your love to keep going for my career life and to be a good vascular surgeon. Thank you.
Thank you. See you next year, Dr. Fan.
Yeah, see you, Dr. Ohki.
And I'd like to also visit Taiwan for Dr. Kim's ASVS in Taiwan next year. Dr. Shiromizu, selfie and a nice smile.
Okay, Dr. Shiromizu's camera is on.
Dr. Shiromizu is from Nihon University. And Dr. Maeda is her coach. Now, she's having trouble with the selfie. Okay.
Oh, okay.
Shiromizu sensei, どうぞ.
Mute.
You are muted.
Dr. Shiromizu, you're mute.
Thank you for your judging and comments. I learned a lot, and I'll continue to practice more. Thank you.
Well, if you had shown your face earlier, I think the judges have given you higher score. Dr. Shiromizu, I think you did very well. I don't agree with the judges, but I have no influence on them. Hope to see you in person. Well done.
Thank you. Thank you very much.
Dr. Yohei Ichikawa, you are the silver medalist.
Yes.
Congratulations.
Thank you. First of all, I would like to thank you for giving this opportunity, and Dr. Azuma and moderator Ohki, Kan and Fujimura, and all judgments. I was very nervous to perform the anastomosis while being watched by so many great legend surgeons, but I enjoyed this game. First of all, for my patients, and I will keep on training hard to be able to compete in the next competition. Thank you.
Well done. See you next year, Dr. Ichikawa, and sorry for Dr. Fujimura's agitation.
Yeah. Thank you very much.
Okay, so the inaugural, the first gold medalist, Dr. Momose, who is at the Shinrigaoka Hospital and also one of my guys at GK University. Dr. Momose,
Yes.
congratulations.
Thank you for your judgment and comments. I'm very happy and honored to get the gold medal. I had with a lot of people watching and my boss, Professor Ohki, watching. I had a lot of pressure and my hand was shaking terribly, but I did my best. I would like to take this opportunity to thank Professor Ohki for his teaching and Dr. Kaneko at Shinjuku General Hospital and the staff at the GK University. I want to improve my skill more. Thank you.
Nice speech. Congratulations. One comment I'd like to make, Werner and Dr. Fujimura, is the fact that the video that was shown by Dr. Azuma, which was introduced as the ideal way of doing an anastomosis, he did the parachute and Momose didn't. I advised him to do the parachute because that was kind of the golden standard among the competition. And Dr. Momose said, I don't want to change my practice just for the sake of the contest. I think that was a pretty good attitude. What do you think, Dr. Werner? Werner?
Yeah, that's what I said. Don't change your practice in this competition, because look, if there is a penalty in soccer, if they do it like every time they succeed, if they want to make something special, they fail. I think it did good job. Congratulations.
Good job, Dr. Fujimura and Dr. Kan and all the participants, judges, and also the performers. You should be proud of being the finalist, and I don't think there was any winner or loser. You were all winners. And once again, Mr. Paku and Ms. Kamiya from EBM, it was a wonderful job that you did. No technical issues, and I think EBM made this possible. So thank you very much for your support. I hope you can send Dr. Kan and Dr. Lang the YOUCAN so that they can try with it. So I'd like to close this session and thank you once again very much, all of you. Goodbye.
Thank you. Bye-bye.
どうもありがとうございました。
ありがとうございました。
ありがとうございました。
Distal Bypass Olympic Games 2021. Senior class is all over. Thank you for watching. See you next year.